So, and I guess while others are coming in, perhaps I hand over now to you to start the third ILCM session.
All right, finally, we are here to start the third session of our incubator discussion for ILCM. For many community members, maybe you know me, that I'm the chair of the steering group for ILCM. So let me but also to let you know that what our ILCM is, that is the first ever global movement in the liver cancer, bringing together patient organizations, communities, medical society, policymakers, and private sectors, and other actors to work together, share resources, and co-create. And our mission is all liver cancer patients are diagnosed in time and are treated with respect and have equal access to the best standard of medical care, regardless of origin, lifestyle, type of liver cancer. Of course, our ultimate goal is a world without liver cancer related deaths. For those you haven't joined us, please simply just log onto our website. It is www.ilcm.global, global, or simply just Google ILCM. I'm so privileged and I'm very happy with our committee and our team that if you Google ILCM 2 months ago, we're not even on the same page. You have no idea how many ILCMs are in the world. But now, guess where we are now? We are in the second place on the first page. So I'm very privileged to see our communities are growing and our awareness is being put into place. Also wanted to introduce the incubator. So as we say the incubator, we are trying to bring people together to talk about different topics, trying to understand something new, something we can make use from the other sectors. So we have our first incubator, track 1, is advancing awareness and early screening in the liver cancer. So it's about what can we learn from the lung cancer, HIV, and other diseases, and where can we find practical examples. And the track number 2 is an access to care, challenges and opportunities. We talk about stigma, discrimination, and also the the challenges on early diagnosis, things like that. So without further ado, today is all about CCA, cholangiocarcinoma. So it has been discussed that CCA is living under the shadow of HCC. I don't believe that is kind of a narrative, but only because the only thing that CCA is not as widely discussed as CCC is only because people just don't pay attention to it, even though no matter how loud the community is shouting to the public and the policymaker. So to let you know that today's topic is all about the CCA. Also wanted to let you know that the upcoming World Cholangiocarcinoma Day is February 15. So I really want you to join us to make sure that regardless of CCA or HCC, we need to focus to address the emergencies and the need for the patients of the community. So without further ado, I just wanted to bring out our dear moderator today, Akim. The person, one of the 3 major, operating team for ILCM to moderate the whole session. And I also want to remind you, the meeting is now being recorded. If you're feeling anything that is not being okay but being recorded, feel free to access and come back to watch our recording again. So Akim, the floor is yours.
Thank you very much, Dee, and welcome everybody also from my side, from the team of the operating committee of the ILCM. Today's session focused on cholangiocarcinoma. It's my really great privilege that we have 3 power women today, and that this 3 power women will, or they are the drivers in rising awareness around cholangiocarcinoma. And without losing time. So we will have 3 short presentations, then followed by an open discussion by all of you. And don't hesitate to ask all questions in the chat, and later when we unmute you, of course, in the open discussion. And now I like to present our first presenter today. It's Stacy Lindsley from the Cholangiocarcinoma Foundation, CCF. This organization has been established in 2006, and CCF's mission is to find a cure and improve the quality of life for those affected by cholangiocarcinoma and bile duct cancer through advocacy, education, collaboration, and research. Stacy itself works closely with various stakeholders around the world, including patients, caregivers, scientists, healthcare professionals, policymakers, and industry partners to drive scientific research to benefit cholangiocarcinoma patients. She frequently presents at scientific meetings, conferences, and symposia. Foundation-supported research outcomes have been published in numerous scientific publications, and Stacy regularly participates in global cholangiocarcinoma advocacy and research initiatives to advance knowledge and enhance patient care. Stacy, it's my absolute privilege that you have now the floor. Thank you very much.
And thank you to the ILCM organizers. Appreciate the invitation. Just going to share my screen here. Okay. Okay, can you see everything? Good? Okay, great. I'm just going to talk a little bit about the global impact, risk factors, and some solutions that we're working on as a community. And then I'll tell you just a little bit about our organization. So these are slides by Jesus Benalis, and so I want to thank him. Just share with you just a little bit of the global overview. Cholangiocarcinoma is a heterogeneous group of malignancies with features of biliary tract differentiation. It's the 2nd most common primary liver cancer. And we know that cholangiocarcinoma incidence is increasing worldwide. So higher in the Asia Pacific regions and not quite as high in the Western countries. And we'll talk about why on this next slide. So the risk factors are multiple. Really anything that irritates the GI system can be a risk factor. And it also depends on the country that we're looking at. In Africa and India, we see a lot of toxins, aflatoxin and oils, different things that are ingested that cause the irritation. In the West, we see more PSC, gallstones, coloductal cysts, while in Asia can be liver flukes, other things, types of that nature. So there are the median age you can see down below is about 66 years. And there are some significant germline mutations attached to that, in about 5% of the cases. So on the right, you can see there's moderate risk, but it's highly prevalent: alcoholic liver disease, type 2 diabetes, tobacco use, and NAFLD or NASH. So one of the most distressing things about this disease is that the mortality rate is going up. And you can see that this is another by Jesus Benalis and Bertuccio. And you can see that the numbers are increasing everywhere. And this is based on the WHO information, the Pan American Health Organization, plus 32 countries. So just to highlight that from that publication, you can see that the lines are going up in virtually every country. So the rise in the intrahepatic cholangiocarcinoma mortality is due to increased incidence. And that's a global rise. So what are we doing to help and assist? This is just a list of the organizations that we collaborate with regularly. There are smaller organizations coming up all the time. A brand new organization in Spain, Atuvivi, you can see in the middle there, just coming online. I believe they're going to be coming online the 15th of this month on World Cholangiocarcinoma Day. We are also working with an Indian organization, patients and providers who are coming together to form an organization there, as well as an organization in Africa. So we're thrilled to see these organizations focused on cholangiocarcinoma research and support coming together. At the foundation, I'll tell you just a little bit about the organization. In the US, we are the hub of cholangiocarcinoma activity. We bring all of the stakeholders together regularly for a conference in Salt Lake City. That this year will be April 17th through the 19th. We have, as an organization, 2 pillars that are our strategic priorities. One is patients and caregivers, serving them, and the other is funding research and breakthroughs. I'm just going to tell you just a little bit about that. You might notice we've got a refreshed logo that happened just a couple of weeks ago. And in April, we are a 17-year-old organization. In April of 2024, we'll be launching a brand new website. The data from our website shows that about 50% of those who are coming to our website are coming through our mobile, and we needed to get updated and make that access easier for them so that they can get access to the information they need. You can see that we're serving a global population, but we're really grateful for these organizations that are working, like Helen's group, which has been around longer than us for about 20 years in the UK. But also, we've been very heavily involved in the group in Canada and some of these other groups, trying to help them get up and get running and helping them think through how they can serve their patients. We feel like when the patients come to us, they are best served if they're from outside the US, if we can connect them with another organization that can help them navigate the system in which they're living. So grateful to collaborate with these other organizations. We have a newly diagnosed portal that a little more than 2 years ago we put up, because most of the patients were newly diagnosed coming to our website. And you can see that we have, through that portal, we have more than 1,700 unique monthly visits. And that has been since August of 21. So these are we know that they're newly diagnosed patients because they take a survey. And you can see that they're patients, they're newly diagnosed, and most of them have intrahepatic, although you can see about a quarter of them don't know what kind of cholangiocarcinoma they have. So I want to just tell you a little bit more about this newly diagnosed portal and this gap that we're trying to close. We use Komodo Health, which is a US-based information data system that looks at the claims of patients. So these are patients who are insured through the US system. And we can see through that data. So patients who do not have insurance would not be in this data. We can see through that there are 244 newly diagnosed patients with cholangiocarcinoma every week in the US. We get 388 of those are coming through our portal. So that's going to be caregivers, patients, friends, whoever's coming through that portal a week. And about 23 of those request a care kit, a free care kit. I'll show you what that looks like, and complete the survey every week. So how are we going to close that gap between 23 and 244? We do that through Facebook ads and social promotions. We do monthly webinars for patients, but we have a specific monthly webinar. So every newly diagnosed patient that comes through that portal this month of February, the 1st of August, there will be a newly diagnosed webinar for them. And Melinda, who runs our patient advocacy, and her team of 7 will help them answer all of their questions, take them how to navigate, how to get a second opinion, how to get in all the information that they need. We do a lot of peer-to-peer outreach, medical provider outreach through the Komodo data as well. We use a system called Pulse of theirs that shows us every time a patient is diagnosed in a rural area in the US. We don't see the patient, we see the provider. Our chief medical officer sends them an email and just lets them know that we can see they've seen a cholangiocarcinoma patient. He connects them, and then we connect them to the foundation and give them the resources they need to help their patients. You can just see there are multiple other ways that we're trying to do that, including additional language support. This is what the care kit looks like. It's just care items for the patients. But I wanted to, and we've distributed over 2,300 care kits in the last 2 years. So just a couple of things from the survey results that might be of interest, that 40% of the patients were not encouraged to get a second opinion from a specialist. 21% of the patients were provided with helpful education materials. So 1/5 of the patients felt like they got the kind of informational materials they needed to help them. 66% felt like they were provided with enough information to understand their treatment plan. But again, only 1/5 of those patients were advised that a clinical trial could be an option. We know about 50% of the patients have a targetable mutation, so there's a big gap there that we need to address. And about 45% of patients were informed about biomarker testing. Those numbers are up, but not where we'd like them to be. We have a free nutrition resource. This was produced in partnership with the Oncology Dietitian Practice Group. It's specific to cholangiocarcinoma and to this community. We've given out well over 2,000 of those. Those are free, and patients can get those through that QR code or on the website. We also have a free question and answer book. We're coming up to 10,000 here on this book. This is a very simple book that has patients asking questions, physicians answering those questions, a lot of information there to help patients navigate this diagnosis. We have a patient education webinar series. This is the most popular one that we've had, and you can see that it's about novel treatment approaches. It was in March of last year and has had almost 2,400 views on our YouTube channel. We've had more than 75 webinars to date, and they average about 500 views on YouTube. And they are all kinds. They're nutrition, socio and economic support, multidisciplinary clinical updates, clinical trials, all kinds of things to help the patients be better educated. Cholangio Connect is a program that started in 2017. It's a mentoring program. It's mentoring for caregivers and for patients. Almost 1,200 matches we have made since 2017. We have 122 current mentors. We had about a 20% increase in asks for mentorship from 2022 to 2023. So you can see where there's significant growth, there's a significant need there. So what we're trying to do is connect these long-term survivors with newly diagnosed patients and caregivers who need additional emotional support or whatever with caregivers, long-term caregivers. The Biliary Emergency Information Card launched in 2017. Patients with cholangiocarcinoma often have biliary stents and drains. They also have procedures that can cause them to have ascending cholangitis, which is an infection that they can die from. This is a very serious situation, and so similar to what you might see in cardiac situation, there's a cardiac card that gives all their emergency information. This is exactly the same thing. It provides a QR code that comes from our scientific and medical advisory board that patients can print this out, take it, put their personal information in, and if they are in distress, especially this seems to happen on the weekends when their physician is not available, they can give this card to the emergency services or whatever. They can simply, do the QR code, and it tells them exactly how to treat this so that they don't get into a more serious situation. So we run an International Cholangiocarcinoma Research Network, the ICRN. There are about 333 members, 157 institutions, and 27 countries participate. And the goal in this was to really collaborate on the clinical translation of scientific discoveries that impact the patients. There are many opportunities and benefits of this. One is that we collaborate closely with NSCA. Our mentorship program is connected. The translational webinars that we do quarterly we do those together. We are also doing a research priorities consensus conference in 2025 between NSCA and ICRN. I'll talk about that in just a minute, but a lot of publishing opportunities, speaking and leadership, a lot of opportunities for the academics here. And this is one of the translational webinars. We just had one on KRAS, which was extremely popular. And we had about 100 live providers on that call. Our upcoming one is PSC-related cholangiocarcinoma, and so we're excited about that as well. Just a couple other things we do. This is about our funding. The cholangiocarcinoma think tank was in May of 2022. We've put about $700,000 of funding into those efforts. This was in early diagnostics and precision therapeutics. And those data readouts first data readouts came in 2023. We just had more data readouts. We're very excited about where things are going there and continuing that. And then also in 2024, we are doing an acquired immunotherapy resistance grant with cholangiocarcinoma. This is a collaborative grant, meaning that the institutions had to put in proposals where they were collaborating together. So that was a $250,000 grant with additional funds coming. We do research fellowship awards. About 2.5 million has gone into these research fellowships. And then another 10 awards will be given in the year 2024, this year. These are just some of the institutions that we have funded across the globe. And then one of the last things I want to talk about was our data partnerships. I talked about Komodo Health. This is rich data for publication and for really raising the information knowledge of the academic community. There'll be a lot of publications or several publications coming in 2024 here. In addition, the CCF patient registry, there'll be multiple publications coming in 2024 from this. And this is where we are leveraging the patient's data. The patients have the opportunity to give us access to their health data in the US, also in Canada. And in turn, that data is digitized. The Scientific and Medical Advisory Board has pulled out the information that they want to see. It's de-identified, and then the data is structured and ready to share for research. So we're excited to see those publications starting to come out this year as well. And really our hope there is to have a really rich natural history data, the ability for pharma to utilize that data in IND filings, a rich publication environment for academia, and really mainly working with the FDA to use that data as a synthetic control arm for clinical trials. This has been the master biliary cancer master protocol trial is something we've been working on for about 4 or 5 years. We're very excited about this. And this is going to be an opportunity for more patients, especially opportunities for patients to be on targeted therapies. We're talking with companies now, a lot of interest in this. The entire academic community in the US is on board with this. This is how we're going to get answers quickly and find solutions for these patients. We're excited to be all working together on this. And then just a reminder that our annual conference is April 17th through the 19th. That's virtual as well. And that in 2025, we will be doing a research priorities consensus conference. This will be globally important because it will set the standard for the priorities in research that we need to fund. We hope it will also give academics the leverage they need when they are going for bigger funding opportunities to talk about these are research priorities set by the global community. So that's it.
Wow. Impressive, Stacey. Thank you so much and giving us the floor and get a better picture of, what does it mean and what your organization is doing, but also around cholangiocarcinoma itself. Thank you very much. And with this, I'd like to hand over to Helen. Helen Mormont, so it's an absolute privilege because she is the initiator of the cholangiocarcinoma day in 2015, and your bio is as long, and I think you will introduce the AMMF yourself very good. But let me say that beneath your CEO work within the AMMF, you have set up in 2002. It's a very old, long traditional organization now, an established organization, an important organization. You do a lot of other jobs as well. And one of the things is you are part of the executive committee member of the Cholangiocarcinoma UK, a Basel British Association for Study of Liver Special Interest Group. And you're a co-chair of the steering committee of the Global Cholangiocarcinoma Alliance. You are also actively collaborates with the ENSCCA, and that is important for the European sector because that's a European network for the study of cholangiocarcinoma. You act as patient representative for the NCRI, the National Cancer Research Institute, the EPA-GI clinical trials, hepatobiliary group, and you review clinical trials and patient guidance information for UK bodies. That's very important, but also for international organizations. And on top, you're a board member of Cancer 52, a UK organization with 100 plus rare cancer organization members. And yeah, you aim to address inequalities that exist in policy, services, and research within the area of rare cancers area. And I wonder how you manage beneath all these things to run such a successful campaign you do, and great conferences. So, but you can explain us now. Thank you very much, Helen, that we have you here today.
Thank you, Joachim. You make me sound, yeah, I don't know what, but you know, and I think Stacey would probably be able to come in and agree on this. If you want something done, you ask a busy person, and I think that's how you get work done, and that's probably what happens with both of us. When there's something to be done in this area, we're the people that are asked to do it. But huge thanks for that very kind introduction. So yes, I am Helen Morment. I am the CEO and founder of AMMF, the cholangiocarcinoma charity here in the UK. And thank you so much, Joachim, and all the ILCM organisers for your kind invitation to speak to you today. I'm going to very briefly introduce AMMF, overview of World Cholangiocarcinoma Day, and then just a very little of AMMF's work, and particularly the Rethink Liver Cancer campaign that we have recently launched. Well, when AMMF began back in 2002, it was the world's first charity dedicated solely to cholangiocarcinoma, and it gladdens my heart to see, as Stacey has shown, how many other advocacy groups there are now. Today, though, AMMF works across the UK and Europe, and we collaborate globally. All those years ago, 2002, we began with three aims: to raise the awareness of cholangiocarcinoma, to provide information and support, and to encourage and fund research. And those aims remain the cornerstone of everything we do today. So first, I'm going to talk about one aspect of raising awareness, and that is World Cholangiocarcinoma Day. And back in 2015, AMMF initiated this day, and we invited 5 like-minded organizations from around the world, the only 5 organizations there were at that time, to join with us on this venture. And the logo, the World Cholangiocarcinoma Day logo, represents the colors of those inaugural organizations, the figures embracing the globe as we all work to improve the future for those with cholangiocarcinoma. And as that one-day annual venture began to grow in influence, AMMF wanted to do more with a globally meaningful, broader, ongoing agenda. So in 2018, we invited leading international specialists and patients to a workshop in London, where the discussions led to the formation of the Global Cholangiocarcinoma Alliance. And this initiative, which began with a shared vision to work with a nationally neutral but globally inclusive voice towards significantly increased global awareness and for progress in diagnosis, treatment, and eventual cure, is now expanding globally and growing in influence, with World Cholangiocarcinoma Day under its umbrella. Now, each year, World Cholangiocarcinoma Day takes place on the 3rd Thursday of each February, which is Cholangiocarcinoma Awareness Month. So this year's date will be the 15th. this year's theme is Be Clear on Cholangiocarcinoma. And as you can see, the colours of the inaugural members are reflected in this graphic and in all the graphics for World Cholangiocarcinoma Day. Just one day in the year when we leave individual organisation identities aside and we become nationally neutral but globally inclusive. And with the Be Clear on CCA theme, we are asking healthcare professionals to clarify, listen, explain, act, and refer in order to diagnose their patients in a more timely manner and to ensure they receive the best treatment and care. How can everyone help? Well, a call to action this year is to get as many people as possible to sign the pledge. And by doing so, to support the Global Cholangiocarcinoma Alliance campaign to raise the awareness of cholangiocarcinoma, and in that way ensure a far better and clearer path to diagnosis. So please, everyone, join us on February 15th, World Cholangiocarcinoma Day. And to find out more about the Global Cholangiocarcinoma Alliance and the day, to sign the pledge, to download graphic assets you can use on your own social media, please visit the Global Cholangiocarcinoma Alliance website. There's a QR code here, but it's just globalccaalliance.com. So back to AMMF and some of the ways in which we work to support all those with cholangiocarcinoma, both in the UK and now across Europe. AMMF's main website is comprehensive, with information on every aspect of cholangiocarcinoma, including clinical trials open and recruiting. It's clear to navigate and continually being updated. But AMMF is committed to supporting not only those in the UK, but also European patients through greater access to the information they need. So we now have a European website too. It's currently available in 8 languages, with more to come. And because all patients need to have access to reliable information in a level of language they can understand, as well as our websites, we have a growing number of informative resources available in hard copy or to download. Many of our other resources are also available in a variety of languages. For example, our patient information sheets for the most commonly used treatments, and these are available in over 30 languages. With the rise in the incidence of cholangiocarcinoma and the advent of new therapies in first and second line after many years of very limited treatments, there's now a greater need for cholangiocarcinoma information to help support pan-cancer organisations and healthcare professionals, not only in the UK, but across Europe. So AMMF has now produced patient organisation education materials available in 3 ways: a comprehensive guide, which is fully referenced, a fast fact summary of that main document, and a companion PowerPoint slide deck. These are currently being translated into a number of European languages to ensure that pan-cancer organisations have adequate cholangiocarcinoma knowledge in their own local language, which, importantly, will help them put together a robust case for healthcare authorities and so enable improved access to treatments for those with cholangiocarcinoma across different European countries. But over the years, we've been growing increasingly concerned to hear and see cholangiocarcinoma always reported as a very rare cancer. And in the UK, the 4 countries of the UK, the incidence is continually reported to be around 1,000 per annum. From what we were seeing and hearing every day at AMMF, we knew it must be far higher than that. And there was a lack of awareness about cholangiocarcinoma from healthcare professionals and the general public. But the available data didn't support what we were seeing. And without robust data, all that we were seeing was considered just anecdote and opinion. And that has no power to bring about change. We needed the cold, hard data to back up what was clearly happening. And if it wasn't available, we would have to get it ourselves. So back in 2018, the process of commissioning our own national cholangiocarcinoma epidemiology work from Public Health England, with our own analyst embedded in the National Data Registry. This work has looked at data from some 50,000 patients with biliary tract cancers between 2001 and 2018. And finally, the results were ready to be presented at AMMF's conference last year, 2023. And this presentation remains available on AMMF's website. Now, some of the significant findings confirmed what we were already seeing. This is no longer such a rare cancer. And with increasing incidence, cholangiocarcinoma is a growing untargeted problem. It is definitely affecting more younger people, and the survival rate is appalling. The mortality is parallel to the incidence. But some of the findings were surprising to us. Over half of the people diagnosed with cholangiocarcinoma received none of the treatments currently available. No surgery, no stenting, no chemotherapy. And there's also geographical variation in the routes to diagnosis and treatment, and also in incidence. This substantial work has now resulted in 3 papers showing the routes to diagnosis, the incidence, survival, and routes by region and socioeconomic deprivation, and geographical variation in treatment. And so these published papers now give us the robust data to show the true situation. And then, quite coincidentally, in June last year, just after our work finished, for the very first time, the NHS, the National Health Service in England, published liver cancer data on their Get Data Out platform. And this supported what we were seeing. It clearly shows that in 2020, the 2 main primary liver cancers, hepatocellular carcinoma and cholangiocarcinoma, had a similar incidence, HCC showing 2792 and cholangio 2706. Yet, whenever liver cancer is mentioned, despite the fact that cholangiocarcinoma is a primary liver cancer too, in the UK, it is usually only HCC that's being referred to. HCC gets the lion's share of attention in just about every area, and healthcare outcomes for those with cholangiocarcinoma currently lag well behind. So, armed with the findings of our data project and the Get Data Out statistics, AMMF believes it is really now time to rethink liver cancer. And our new campaign, launched at the start of October's Liver Cancer Awareness Month, is asking for more attention for cholangiocarcinoma, regionally and nationally, to recognize this as a cancer needing far more recognition, to enable earlier diagnosis, increase access to treatments, and to reduce inequality. During October, our campaign received much social media and press coverage, including interviews and articles in several national newspapers. And we had support from Zandra Rhodes, the international designer, who's been diagnosed with cholangiocarcinoma herself. But we need to reach those who can actually make changes within the health service, and that was still proving difficult. The findings of AMMF's data project underpin our Rethink Liver Cancer campaign, but now also our white paper too. And our white paper addresses important misconceptions and provides concrete evidence of the urgent need to improve how cholangiocarcinoma is recognized, is diagnosed and treated, and the white paper is available to download from AMMF's website. So we've come a long way. We now have that cold, hard data, robust data we've long needed. But the work in changing and improving what's happening every day across the UK goes on. The perception of cholangiocarcinoma being a cancer of low incidence seems to continue, and with it, the lack of awareness, which leads to many people not getting the care they should have. So on 20th of February, AMMF will be taking the campaign to Westminster, where we'll promote the white paper and its asks to those within our government, the health service, and all who have the power to make change, to raise awareness, and to ensure that those with this devastating cancer receive better and more equitable care than currently. Because only when that current scenario changes, with better recognition of and improved attitudes towards cholangiocarcinoma, can patients be confident that their needs are being taken into account and that they're receiving the best advice, treatments, and care, which is no less than they deserve. And finally, if you'd like to find out more about cholangiocarcinoma in the UK, across Europe, and indeed globally, and about AMMF's work, and there's only been time this evening to give you a very brief glimpse, please join us at AMMF's next international conference, which will be 8th to 10th of May in the UK. So thank you very much.
Helen, thank you. That's absolutely amazing. And yeah, please join these conferences of both organizations. And ILCM is proud to have a booth at your conference, MMF. So thank you very much for the invitation there. And with this, I'd like to hand over to the next power woman. So it is Yasmin Hassan from AstraZeneca. And it's my privilege to introduce you because there's a unique situation. You're a doctor. On the one hand, you have worked on the field. You have a main interest of, to encourage the situation and improve the situation in middle-income countries and low-income countries. We have now seen we have a global problem. And on the other hand, you are very much keen to empower women and patients in general. So it's my absolute pleasure, Yasmin, to learn from you how you think we all together can use cholangiocarcinoma Day this year to raise attention, of course, in the European part, in the American part, but also how we can help to support our friends, our partners all over the world with this global aspect. I hand over to you, Yasmin. Thank you very much for joining us today.
Thank you so much, ILCM, for the invitation. And I'm the privileged one to be attending today. And I wouldn't call myself a power woman with those amazing, two powerful advocates, leaders that we see today. So I guess a lot have been discussed cholangiocarcinoma and how we are really looking at it as a rare disease. From an industry perspective, how can we really support and advance that further? More of how can we support the mission that's going on? Organizations, something like CCF or MMF, or even how we can advance those collaborations across the globe. Really multiple roles, seeing countries as well as more of the developed countries.
Yasmin, so we have problems to hear you. Perhaps if you have the option to use other speakers or microphone. We can't hear you.
Hello? Is this better?
Much better.
My speakers. Perfect. All right. So just going back to what I have been saying, really, we are really here to more of like advance and like support further what the community has been going on and supporting with the mission really from cholangiocarcinoma perspective. A large part of AstraZeneca's commitment, or really I would always like to start with how we are always putting patients first and how a large part of this commitment is going towards gastrointestinal cancer, specifically uh, cholangiocarcinoma and hepatocellular carcinoma. And because we are really looking at both of them, it's always really powerful to really see how we can differentiate, how we can support communities to really raise awareness on those two different diseases in a different point of view. As you mentioned, and as it was mentioned by MMF and CCF, there's always a growing, I would say, awareness around HCC, or a lot of people or a lot of patients and in the public, they know more about HCC than cholangiocarcinoma, while cholangiocarcinoma is a really primary type of cancer, as well as it's actually a rare disease that is hard to find or hard to identify. So from AstraZeneca's perspective, what we really want to uplift is that awareness and patient education, as well as really how we can empower patient advocacy groups to grow more and more, whether the current patient advocacy group or even support them to really connect them with more of the countries that maybe have no access at all to such privilege, even at having an advocacy group. And really, I would really say that working back in Middle East and Africa at some point, or working back at a lot of the developing countries, I would really say that I guess some of them wouldn't even have the access to the right patient education or the right resources. Maybe they end up like just looking online or not really having the support they need. Not to mention the stigma that is there. And this is another really powerful barrier that we would love to be working on, because it's a barrier to really get diagnosed in the right time. And it's also a barrier to make sure the patient is empowered to get the right treatment access, to feel prioritized, as this type of cancer, unfortunately, is not really prioritized in a lot of healthcare system. And this is also another, I would say, mission that we will be working on. AstraZeneca have like advanced the department from, for example, being focused on patient engagement and patient affairs to even more towards patient advocacy and policy. So we can really see how we can offer resources and how can we support communities like yours to seek, I would say, policy impact, practice change, see how we can really prioritize such disease in a lot of countries, whether they're developing countries or developed countries. How can we connect multi-stakeholders together? How can we, example, uplift multidisciplinary teams in some healthcare system, even by maybe educating healthcare professionals, connecting the community with other clinical communities? Because after all, maybe this could help in the early diagnosis for the stage shift, which is also one of the key barriers, or even that part of really taking the patient to the right pathway. And we have seen a lot of like initiatives by CCF and MMF that really are focusing on those. And you will really see us always partnering and empowering such initiatives rather than creating our own, because at the end of the day, I really see pharma as like partners to really support and uplift those missions rather than really like focusing on our own initiatives. Finally, I really see this as a collaboration, more of like a collaboration to stakeholders. And the more that we collaborate and the more we connect with like patient advocacy groups, or even if it's a small community somewhere in a country that never had the privilege of having the mentality of patient advocacy, maybe this could really connect us and really grow the community of cholangiocarcinoma. And we will continue supporting the creation of new resources for cholangiocarcinoma, like toolkits, like maybe even technology to support the early screening, the early diagnosis, and so on and so forth. So we'd really like to thank ILCM for really bringing us together. And we are really privileged and proud to be part of ILCM to drive progress in liver cancer prevention, early detection, and finally, really supporting patients to have access to the right treatment. Thank you so much for today.
Thank you very much, Jasmine. And I think you mentioned one important point, and this is really, so I like really to think about the invitation of both organizations to join their organizations. The more members both have, the better you are connected both organizations, the better we can spread the word around cholangiocarcinoma. And we are really proud to have you both as a member of the ILCM. And we have in the chat one question from you, Jose. So it's great to see you here today. So the question is Cholangiocarcinoma Day an official day on the WHO agenda? Helen, Stacy, Yasmin, who likes to answer? Helen, you are muted.
I can come in there if you like. I don't believe it is at the moment, but we can work towards that. The WHO are approachable. People think that there's some amorphous group somewhere working away, but yeah, you can speak with them. So I will speak to the Global Cholangiocarcinoma. World Cholangiocarcinoma Day is now under the umbrella of the Global Cholangiocarcinoma Alliance, and that is run by a secretariat, and I will have a word with them in the next few days and just see how we can move forward. And if we're not on the radar of the WHO, then we will be. But, you know, I think what you have to understand, and I think that many people, even within the ILCM, probably don't understand, is how under the radar cholangiocarcinoma is.
Yeah, I know, and it is not that I only want to be involved if it's recognized by the WHO, but sometimes there's more organizations who organize for the same theme different days and months, and for me as a small country it's very confusing. And also we have also here an umbrella organization for Live Patient International that we discussed. Yeah, but but there was also an American Day, and that's another day. Then it's not especially for cholangio, but that's what we notice if you are involved in more liver diseases. So I try to find a way that, okay, if it's on my way, we can always like the social media. That's not the point, but if you really want to be more involved, and I thought, well, but what organization? So I'm trying to find a line which I can follow, which make it easier, because you and I love to be involved with the AMF, but then the other organization comes to me and is that, but we're doing the same. And oh my goodness, but I like you too. And so I really try to find a more, well, not scientific, but more an organized way. Who can I follow? What's in for me? And the world of cholangio, of course. But it's just that I thought, okay, another day, another month, and I noticed that a lot with the HCC. But what is the? So I think I make my point, like, so, or maybe it's something that you are more involved in cholangio. It's one of my liver disease in my association, and but so that for me that will be very helpful, and I think also for other patient organizations who have also cholangio on the radar, but it's not their main focus.
Yeah, but I think so. What is extremely helpful here is that both organizations offer a good material in a lot of translation. And I think so if you adopt just and to introduce this to your country community, it would be very helpful.
Yeah, but that's not my point. No, I'm really impressed about all the materials, and I'm happy to use that. But it's more like, which day do I use, or is it always the same? Which organization do I follow and use? And it's more like that, and it's not, I do the AMF because I'm Europe, or because maybe in the States there are happening wonderful things as well. So I try to find my way in the landscape. So and I thought it's very helpful if you say, but we recognize with the WHO, because then it's very easy for me. But it's not the reason. not that I say, oh, if you don't, well, then I'm out. No, not at all. Not at all. Don't misunderstand me.
But perhaps, so we have 3 persons in the room who have managed that there is an official WHO day. It is Dee, Raquel, and myself who have lifted up virus hepatitis to an official WHO day, and it was a game changer in the field. We should dive in deeper. I got a question from email to both of you, Stacy and Helen. So how the academic field, like the big scientific organizations, are supporting this day and how they can join? Stacy, you like to answer?
Sure. I would say in the US, the academics are all, they're mostly involved on Twitter. And so you'll see a lot of them posting. They're very active there. And I mean, I think they're very supportive. There are things that can be done in the US much more easily through a nonprofit like us than trying to work through the red tape of the academic centers. And so it's, they're always very willing to work with us and want to work with us. I would say just a comment on the previous conversation, which is that Helen and I have been collaborating in the cholangio space for well over a decade. I think we try to help every other organization, both of us, that's up and coming. We both realize we do our best helping within our countries, and other patients will be best served within those systems. We want to help them. We're always helping them. We're always working together on keeping each other updated on what we're doing. And so I think this is maybe a unique space. We don't have, we're not competing with anyone in the US, and I don't think Helen's competing with anyone in the UK, but we're all trying to collaborate. So that's been important for us in the US. So I think we're all trying to work together. We all have the same desire. We want the patients to have better options, and we want the researchers to have access to the funds they need. So that doesn't get in the way. Nothing else can get in the way of that. So
absolutely, totally agree, Stacey. That couldn't have put it better. But I think this one day is for the whole world. I don't think there is another competing day. There is no other World Cholangiocarcinoma Day, and the whole of February is Cholangiocarcinoma Awareness Month. And I know that just bringing it back round a little bit, that there were a lot of conversations going on about October being Liver Cancer Awareness Month, and should that change? And the problem we would have is that it's very well established in the UK. Not so sure about it in the States. Probably, Stacey, whether it is or not. But people were saying, let's change it to February. Well, no, because that's our month. We don't want February to be changed. So
yeah. I have one question via WhatsApp to the 3 of you, Yasmin, Stacey, and Helen. So I got a question. Is there a focal point in the Asian Pacific Room, an organization who provides material in these languages in this area? Are you aware of?
yes.
Yeah, there are very strong Thai groups at work. There's a very good Japanese group that's up and coming. There's a group in Taiwan that's there's just some things that are just getting started, but Helen can probably give you more information. I think we both worked with the Thai group, but she has certainly worked more in-depthly with them on, publications and things, so.
Yeah, Cholangiocarcinoma Foundation of Thailand, based at Khon Kaen in northeast Thailand, which has the world's highest incidence of cholangiocarcinoma, which Stacey alluded to in her talk, which is it's a different type of cholangio because it's liver fluke induced, but we learn a lot from them, and they really like to collaborate with us and learn from us. But yes, there is huge support, but the difficulties they have is a lot of the affected people are very rural populations, and although they produce excellent materials, including apps, would you believe, for these indigenous populations, you know, they have difficulty in, well, they have cultural problems, socioeconomic problems, endless problems in Southeast Asia. Yet we are seeing, because there's a lot of work going on in Laos, in Cambodia, in Vietnam now, I think it's an explosion. If we knew the true data in those areas, cholangiocarcinoma will probably be one of the most common cancers in the entire world, but we don't have the data.
Okay,
Sorry,
great.
Segueing completely off what you asked, but it's
Really, that's the issue, Dee, I would say, with separating cholangiocarcinoma from liver cancer. We will never have true data if we can't get those cancers separated. In the US, we still, right, intrahepatic is still pooled with liver. Well, that doesn't tell us what we're actually dealing with, and we need to know what we're dealing with so we can develop strategies to, you know, to serve these patients. So
this is Ting Ting from Here to Care. We are a patient advocacy groups for immigrant cancer patients in the United States. And we recently dug out some data from the Wonder database out of CDC, and I'd like to share that with you. And this is where we actually were able to separate Asian American HCC data from all the other liver diseases and based on the ICD codes. So I will do that later after the meeting. Thank you.
Great, thank you very much. And before I hand over to you, Dee, to sum up, so it is really my pledge to all of you to support the World Cholangiocarcinoma on the 15th of February, and be clear with cholangiocarcinoma. I like this motto very much because it includes all the aspects we have discussed today. And please, to everyone also who are now listening to the recording, perhaps this evening or tomorrow, so sign the pledge. And from my side, it is an absolute privilege and pleasure to work with you, the three power ladies, Helen, Stacy, and Yasmin. Thank you very much. And with this, I hand over to the chair of the ILCM, Dee, to close the session. Thank you very much.
Also, although it's 30 minutes to midnight, but I feel like this 65 minutes is way little for me to understand, to have a much clearer picture for CCA. Especially when I come into my mind is what are the voices for the communities in the high risk groups, in the countries with the highest burden, especially for the Mekong River. That reminds me that there are still, I'm not even talking about the rural area, the First Nation people who are eating raw fish on a daily basis. The people around me in Pearl River Delta in China are still eating a lot of raw fishes, and not say a lot. I had 3 relatives of mine die from CCA because of eating raw fish. So I'm living in a city of 23 million, one of the top 3 cities in China, but still, I'm saying that we still need a lot of the time, and the liver cancer community should work together to build different bridges to make sure our voices are heard. And please join our movement next week for World Cholangiocarcinoma Day. So let's see how we can go from there. Right. Thank you so much for the community members to join us. So please, if anyone that revisit our video, please drop us a likes in the social media. Thank you so much. Thank you all, especially to Helen, Stacy, and Yasmin. Thank you so much.
Thank you so much, everyone.
Thank you, everyone.